Dumelang, Sanbonani, Mzansi. Welcome to another episode of The Health Club. I'm your host, Clement Manyatela. This is a show where we take control of our health one real conversation at a time. Today's episode is all about the future, and the future is now. It's digital, from telemedicine to health apps, wearable tech to virtual doctors. The healthcare game is changing fast. But are you keeping up? Well, don't worry, because today we'll help you understand how these innovations are reshaping the way we care for ourselves, and how GEMS is helping make this transition smoother, smarter, and more accessible. Have a look at what's coming up today.
People want to have technology to use to make their lives simpler, better, faster. You don't always need fancy gadgets. You don't always need fancy applications or whatever.
How soon are we likely to have?
Yeah, we have the device that you're talking about right now for a clinical trial.
Anything that includes money, I want it physical.
I'll just use the virtual assistants.
You know, obviously a phone call is much quicker than traveling 30 kilometers away to go see a GP and wait in their waiting rooms.
There's no denying it. Technology is now part of everything we do. From how we move to how we connect, and yes, even how we take care of our health. We're living in a time where the medical world is evolving at lightning speed, and sometimes it can feel overwhelming. So today, we're here to unpack this fast-moving digital world of healthcare and make it simple, because at the heart of it, it's all meant to make life easier for you. But first, as always, we hit the streets to hear from you, and we've asked you whether technology has actually made things better when it comes to your health. Here's what some of you have had to say.
I don't use my phone for medical uses because I'm still a student, so I rely on my parents for medical use and like medical aid.
I am quite finicky about medical, so I take that thing seriously, and it doesn't have to be on my phone.
I think it's much more simple on my phone because I get to get help quicker.
I have had a consultation virtually, and because it was convenient instead of going to the offices and getting a medical aid.
Yeah, I use my phone most of the time to track my health, usually with gym and all that, yeah.
I don't use my phone or a smartwatch to track my health.
I would choose to consult my medical, using virtual medical aid, because it would be easier for me instead of going to a doctor for just a consultation on where my body's going wrong. And I'll just use the virtual assistants to know what's going on with my body at the comfort of my home.
Physical for sure. Anything that includes money, I want it physical. I have to see you. I have to have that intuition that, okay, whatever I'm signing up on is taken care of. So physical for sure.
It's easier to consult on my phone rather than spending money going to maybe the surgery or to the doctor's center, because I feel like it's more convenient and it's less saving. I'm saving lots of money, such as traveling costs and such, and etc.
I wouldn't trust an AI-powered app for my medical advice because, again, it is my health.
Every knowledge you can get, it's there. You have every knowledge you can get there on the internet.
One of the most exciting developments is telemedicine, being able to consult a doctor from anywhere at any time. But how does it actually work in real life? We hear from Muhammad Kaji, who's the co-founder of Doctors on Demand, who walks us through how their platform is connecting patients with real doctors via WhatsApp video, and how wearable tech is helping them make more informed decisions for their clients. Take a look.
Muhammad Kaji, Chief Operations Officer at doctorsondemand.co.za. Well, doctorsondemand.co.za is a telemedicine platform We see patients via WhatsApp video call from anywhere in South Africa. It's as easy as going to our website, choosing a consult, filling in your contact details and your reason for consult, confirming the appointment, and then our practice associates will be in touch with you to send you your consult link. Anything physical is then referred to in-person care. The biggest benefit is cost. In terms of savings, a GP now could cost as much as 500 Rand, but with a telemedicine consult with us, it's 285, for example. Obviously a phone call is much quicker than traveling 30 kilometers away to go see a GP and wait in their waiting rooms. So in that sense, in rural settings, it's really easy to just see a doctor over a video call rather than need to travel to go see the doctor. Well, the biggest risk is the quality of the medical health professional or the doctor on the other side. With telemedicine, you aren't able to examine the patient, so you really need to depend on your knowledge base as well as a medical history and a very thorough medical history to make the diagnosis. So, it's incredibly important to make sure that the doctor that you're seeing has the knowledge and experience to be able to understand what you're describing as your symptoms and make a diagnosis. Ultimately, ethics is practiced by individuals, not by machines. So the companies themselves have to have a code of ethics that everybody is held accountable to. It's going to keep growing. It's going to become much more pervasive within our private and public healthcare sectors. It's going to reduce the costs of healthcare, and it's going to increase access to healthcare. And healthcare professionals now are starting to understand the impact that wearable technologies as well as telemedicine technologies are able to give them in terms of an advantage on making diagnosis and treating patients. So, we're going to definitely see a growth in telemedicine services, as well as the increased uptake of telemedicine across, South African society and globally in the coming years.
So as you can see, the possibilities are endless, and that was just a glimpse into how technology is changing the way healthcare is delivered. But what does this actually mean for South Africa? What's really possible here at home? Joining me now are two incredible minds in this space. We've got Khadija Jamaluddin, who's the Chief Director of Sector-Wide Procurement at the National Department of Health, and Nkgape Tsebesebe, CSIR PhD candidate and expert in machine learning-powered diagnostics in Biophotonics Group. He's also registered for biomedical engineering at UCT. Khadija and Nkgape, thank you so much for joining us.
Good day.
Let's start with you, Khadija. From a health perspective, how ready is our system to integrate this digital healthcare that we speak about at a national scale?
In terms of system readiness, I think you need to take it from 2 points of view. The first is the people aspect. People want to have technology to use to make their lives simpler, better, faster. On the physical side, where you have your health establishments, how ready are the health establishments, our health facilities to integrate health technologies? I think we have a way to go, but we've already started on this journey. And once you're on the path, Nelson Mandela said the journey of 1,000 miles starts with the first footstep. And I think we've taken more than one footstep in this area. And there are a number of interventions, number of tools, number of systems which we've implemented, both at at the national office as well as in the facilities, which demonstrates that yes, we are ready for technology. The appetite is there, and we do know what needs to change to be able to integrate more of these systems into how we do things.
Yeah, Nkgape, you're always on the edge of technology. What are some of the most promising innovations you're seeing, especially on the local front?
Okay, so some of the innovations that are really in the market currently is just a power diagnostics one. So where just a machine can tell if you're having a certain disease before it can even develop in your system. Imagine that kind of situation. So you can be able to take care of yourself and do some precautions based on that. So that's what we're basically developing at a time.
Yeah, and Khadija, how ready are our systems? Because it's one thing to say we want to start implementing and integrating this digital healthcare, but when you look at procurement, when you look at policy as well, are we getting there?
I think we're further down the road that people realize. In terms of the systems that we have in our procurement space, especially with the supply chain management for medicines, we have quite a sophisticated system using very simple tools that helps us to manage our supply chain, helps us manage procurement, helps us manage medicine availability, also helps us manage our supplier performance. You don't always need fancy gadgets, you don't always need fancy applications or whatever. It's just the ability to get the data and to use the data in a way that is more meaningful for patients on the ground.
So biophotonics then, Nkgape, how is that going to work? I mean, are you dealing here with a machine? How would it work?
So what it happens is that the machine learning, mostly what we know is we are trying to imitate how a human mind works to try to diagnose this kind of disease. More like how doctors do diagnosis, but we are trying to get that into a machine to do that for us. So as she said about the affordable devices, that's what we are focusing on. So we are coming up with small devices that can be affordable, very low cost that you can afford it, but that can help you to diagnose and also predict if you are about to have a certain virus that's coming or maybe to be infected with something. So it's just a matter of only tracking the patterns of a certain virus that we are tracking that particular time. Then it tells if you are at risk or not. If not, then what to do, and if yes, then what to do as well to make that decision.
How soon are we likely to have?
Yeah, we have the device that you're talking about right now for the clinical trials.
So this is still for clinical trials.
Yeah.
So how soon are we expected to be done with the trials?
By the end of this year, if it passes, then it should be out.
How do we get people to also start interacting with these kind of new technologies? I wonder, Khadija, because especially the older generations, they still believe in the physical consultation.
As with anything, not just biophotonics, it's the trust that people have in a particular system. So once we trust that, the information that we're receiving back is actually credible, trustable, it's going to give you the consistent kind of results that you want. I think the uptake and the appetite for people to then embrace those kind of interventions, those technologies will be much better.
For people watching it and thinking, this is too far-fetched for us, how does it change their lives wherever they are?
Well, in remote areas, that's mainly our focus right now. So what we are trying to do is we are trying to work in present and in future at the same time. So in present terms, that's when we can help them to know their status, if they're having a certain virus or not. So imagine if you know your health now. So it means you can live a healthy lifestyle, and then we can prevent some of the diseases to causing some death on people at the remote areas. And for the future purposes, that's when we talk of predictions. To try to predict if a certain area could be affected of a certain disease for some. So let's say maybe we're having a virus like we had with COVID-19, for example. You remember it kept on evolving like that. So if we can predict that a certain area is bound to be affected by that, then we can save life of those people there.
Well, that was just a teaser from our guests. After the break, we go deeper into these answers and ask, how far are we from this digital healthcare future we're dreaming of? There's lots to cover after the break as we continue this conversation. Stay with us. Welcome back. Before the break, we were exploring the state of digital healthcare in South Africa and the incredible possibilities that lie ahead. We still have Khadija and Nkgape in studio with us. Khadija, let's pick up from what COVID-19 actually taught us and what systems you were able to use as government. I know there's the National Surveillance Center. Just explain to us about how that works and how it fits into this digital healthcare we speak of.
Okay, so the National Surveillance Center is the one place where you have visibility of everything that's happening in the medicine supply chain space. So we know how much stock suppliers have, we know how much stock is sitting at facilities such as primary healthcare facilities as well as hospitals. And what this helps us to do, giving us that visibility, it helps us to do the planning properly. So we are able to say, given what is sitting at facilities, given what is with suppliers, we are able to match the demand and the supply side to make sure that medicine is always available and there's no stockouts. So Clement, let me ask you, during the pandemic, did you hear of any media reports of stockouts at public healthcare facilities?
No, I don't remember that.
Exactly. So that was the really hard work and dedication of many people to help us get to the point where we could use the data from the surveillance center to be able to do those planning process. processes. Let me just say that, initially we were just happy to have visibility of what was happening in the supply chain. And as you say, the possibilities are endless. Once we were able to use the data in a way that was more meaningful, that made it easier for us to manage the supply chain, it really was a game changer in terms of how medicines are made available in the public health sector at present. Even during COVID-19 pandemic, we were able to get data from private sector facilities. Remember, we gave them vaccines, the COVID-19 vaccine to administer, and we were able to monitor the levels at the private sector facilities, as well as what was in the public sector facilities, and we established what was known as a control tower to help with the movement of those vaccines wherever it needed to go. So although having the visibility is one thing, it was like pat, happiness, but actually using the data in a meaningful way. And it was almost as if though we were preparing for the pandemic, because we had these systems in place, or we were developing these systems before the pandemic actually hit us.
And I can imagine, I'm just thinking now, if we can have a system like that where you're able to monitor what's happening in other parts of the country, we should at some point have a system where you can access your medical records from anywhere. How are we approaching that? Is that going to be happening soon?
So there's already a project in place to establish what's known as the electronic health record. It's already in pilot in certain districts and soon to be rolled out. Obviously, with any technology, you have to make sure that it's scalable, and the scalability will be one of the interventions that will be applied in terms of the electronic health record.
Okay, Nkgape, you spoke about these AI tools that are being tested and integrated in real-world settings. What have you been able to observe in as far as the impact on the people on the ground is concerned? Throughout the tests, what have you picked up? What kind of impact are you seeing being made?
Through the clinical trials, what I've seen is that the devices that we have are quite fast. They're quite quick to diagnose. Imagine a case where you have to go to a hospital to do a certain diagnosis. For example, say you do the radiographs, and then it takes some days for you to get the actual results. I can tell you now that what I've seen is you get the results within even 1 second of one person. Even about, if you can have 100 of them, because the trial we ran about 500 of them, we are able to get the result within 1 second, and all of them, the results were out. And they were classified or diagnosed accurately. So say you can get an accuracy about over 80% of that. We are talking on the machine level. And then that could be confirmed by a medical practitioner.
Yeah.
So, and then we're talking 500 people in about a second, you see.
That's quite incredible.
Yeah.
That's quite incredible. Are you working with the private sector, Khadija, in as far as this new technology is coming? Are there opportunities, not just private sector, even academia?
I see opportunities for us to collaborate so that we can say, okay, if that community is at risk, what medicines do we need to make sure is available in that community, so that if it does occur, or if we need to provide prophylaxis to that community to prevent those kind of infections, we can quickly mobilize those kind of resources.
What have been some of your challenges, Nkgape? Have you seen any challenges with training data in as far as infrastructure is concerned, and maybe even the buy-in of just South Africans on the ground?
Yeah, one of the major challenges for everyone who's working in the field is always the data. So you hear every aspect from the AI talking about we have a limited data to really train our algorithms.
Yeah.
So what we did, we have developed a new ways of coming up with data to predicting data. Because every disease, depending on what kind of a disease, it has its own signature. There are some things that we are looking for to be able to diagnose that. So we are coming up with a new technique to generate this data that creates those particular patterns, artificial patterns that resembles that particular disease. So what I'm telling you now that we have managed to get out of there, it was one of these techniques that we usually developed to come up with the new data set. Like it can create a data depending on the kind of information we have from the doctors to saying this is what we expect, but we don't have much data to really give us a pattern of that. So what we do is we're creating artificial ones to do that. And then we are able to train the machine learning algorithms to really learn from that artificial data and then be able to apply it in real-time situations.
So what does this digital healthcare look like in as far as data protection is concerned? Because as you can imagine, there's a lot of sensitive information that's going to be stored somewhere. These AI tools are taking all that information. So are there protection measures in place to protect our data?
There are certain protection measures that we take into consideration to really protect the data, because we understand that is very sensitive data that doesn't need to leak at a particular point. The data is stored. So what machine learning does, they learn from the data, but they don't really get the data out. So we train them, we learn from the data, then we get the end result from that. That's what is being used. So in the end results, we don't have any data there. We only have the information about what it has been trained on.
Yeah, and Khadija, lastly, what do you say to South Africans watching us who are in far-flung areas who are thinking, hey, I hear this technology you're speaking about, but am I ever going to experience it? You know, maybe they're worried about infrastructure, internet infrastructure in their communities. Is everybody going to be brought along? Are we not going to have a situation where people in rural areas are left out? Even hospitals in rural areas and clinics are left out.
What I have to say to them is that they are already beneficiaries of the systems that we've put in place. Because even in the rural areas where there is no connectivity and in some cases no electricity, our systems are in those clinics already, because we use cell phone technology to get the data that we do need. And the way we work is the patient shouldn't feel, the kind of hair pulling and effort that we put into making sure that they get their medicines. We just want, when you present at the facility, your experience should be a pleasant one.
Wonderful. Khadija and Ngabe, thank you so much for taking us through what we can look forward to and what we are already benefiting that we may not be aware that we're already deeply within this digital healthcare transformation. Thank you for making time for us.
Thank you so much.
Yeah, thank you once again to our guests for shedding light on the evolving landscape of digital healthcare in South Africa. As we continue to explore how technology is transforming access and delivery, it's essential to stay informed about developments from key players in the sector. So let's now turn our attention to the Government Employees Medical Scheme, GEMS, for the latest updates on their initiatives and offerings.
In this edition of GEMS News, we explore the role of technology in healthcare. Technology continues to transform the health industry, enabling easier and better access to services. At GEMS, our self-help digital channels like the GEMS member app, portal, and USSD service are designed to offer you access to a range of information to help you better manage your healthcare needs and stay informed. Our self-help channels make it easy to check your benefits, submit claims, and update personal information. These tools are part of our commitment to convenience, allowing you to save time, avoid long queues, and access the support you require whenever and wherever it is most convenient. For more information, visit the GEMS website or get in touch with us through our social media channels.
Technology is not just shaping the future, it's already changing lives. From your wristwatch to WhatsApp, healthcare is becoming more accessible, more efficient, and more personal than ever before. But it's up to us to use these tools wisely, to ask the right questions, and to demand innovation that serves everyone and not just a few. Siyabonga, thank you for joining us today. If you've learned something new, share it. If you've been inspired, act on it. This is the Health Club, brought to you by GEMS, where we come together to live better, think smarter, and take control of our health. Join us next week as we continue to unpack the issues that matter. Until then, stay healthy, stay curious, and stay connected.